Hi guys, Jasper here. So today is, let me see, what day is it? It's Tuesday, February the 4th. So today is 2 days before I get my my hip replacement surgery. With that in mind, since I posted the announcement video, I've had several people ask me or mention or suggest that I vlog the whole kind of experience of the hip replacement and the recovery and so on. So with that in mind, I thought to myself, you know what, that is something I could do. So, and I'm going to keep it to as much real time as possible. So, a little update. As I'd mentioned before in my previous video, in my announcement video, my surgery date is February the 6th, Thursday, so 2 days from now. And that's for a full hip replacement of whatever that entails, so be it. What I've done up to now is, last week, I went for my appointment, which was at the Collingwood Hospital, which was with a, I guess, therapeutic nurse, whatever the words are, I'm not sure, but she teaches you certain exercises you're going to do after your surgery. She teaches you all about the equipment that you need, a walker, a cane, maybe some kind of a commode or razor for the toilet seat, how to sleep, the positions to sleep in, and many things. And it's really quite interesting. It took about an hour for that particular class, along with 3 or 4 other people that was also getting rather knee and or hip replacement surgery. Yesterday, I went for my post-op, and that included 5 different things that I had to do. And I'll see if I can remember them. So the first one was a meeting with the pharmacy technician, and that's to discuss any and all drugs that I am taking right now, or medications. The next one was with a nurse. She did my blood pressure, temperature. She talked to me about everything that's going to happen that particular day, and what I can and cannot do as far as when I can eat before the surgery, up to what time, which was midnight the night before, what and when I can drink before surgery, which was basically clear fluids or coffee, tea, black, no dairy, up to 2 hours before my surgery, and lots of other little kind of do's and don'ts. Of course, no smoking, no drugs, no alcohol, all that kind of thing. The next one after that was for the lab technician for my blood work. So they drew blood, and off that goes for whatever thing they need to do. After that, I met with the anesthetist. He talks about everything they're going to do and my options for my anesthetics and so on. And I have basically 2 options. What they prefer is a spinal freezing, and in conjunction with a lighter kind of sleep. I personally feel much better with a general anesthetic being out, the mask gone. But one of the reasons they like doing it with the spinal is because as the freezing wears out from the midsection, apparently down the leg, the pain, which is going to be severe, kind of creeps in slowly, and they can manage the pain better in the post-op department or recovery department. Whereas with a general anesthetic, you wake up and the pain hits you all at once because there is no freezing taking place that took place. So that's one of the things. But either way, they do everything they can, of course, to manage the pain in the patient regardless. So at this particular point, I think I'm still going with a general anesthetic, I think. Oh, I'm about to sneeze. Anyhow, and then the last one was x-rays once again, because the surgeon wanted final x-rays. So that's what happened in the post-op, which was yesterday. The only thing I have to kind of take care of right now is for Thursday. Right now, we've got lots and lots of winter weather going on. You could probably see out of the car. And Joanne, my partner, she doesn't really, well, she's not at all a winter driver, so it's just making the arrangements for my transportation to and from the hospital, and I can get an Uber to the hospital. Coming home's a little harder. 2 reasons. One is you've just had hip replacement, and secondly, you're not 100% sure if you're coming home that same day. It depends. One of the things the nurse explained to me in my pre-op was, she explained how the whole day was going to go for me. But at the end of, or towards the end of the day, the physio people come to me and they get me up, and I have to do certain things. I have to walk with my walker. I have to navigate steps with my walker. I have to be able to urinate and some other things. And then they'll decide, yes, you can go home if I can do all these things adequately. If not, they keep me overnight. So that's another thing there. But so transportation is one thing I still have to arrange. But apart from that, I've got everything I need, all the items that I need for my recovery, as far as, you know, a long-handled shoehorn and a grabber stick to pick things up, because so many things you cannot do after the surgery. You know, it's all online if anybody's actually interested in what you can do and all the precautions you have to take after hip surgery. It's all online to look at. And it's a lot of stuff. It's a lot. It's quite intense. But so yeah, so that's basically all I wanted to talk about today, was give you an update in as much real time as I can, and I'm going to vlog as much as I can. The next vlog you'll get from me in this regard will be hopefully the day I come home from the surgery, assuming it's the same day. I'm hoping it's the same day, but we'll see, whatever. So I am going to vlog as much of my recovery and how I'm feeling, what I can do. Can I walk? Can I not walk? How far can I walk? And, you know, when can I walk? When can I start doing more exercises? When can I drive a car? They're telling me it's up to 6 weeks before I can drive my car again. Some people say 4 to 6 weeks. So that's a long time. You know, if I can't drive my car for 6 weeks, it's going to be much longer, obviously, before I get back on trail. But anyhow, so I just wanted to tell you that, and I'm going to put all this in a newly created, what do you call that, a playlist on my site, and I'm just going to call it Hip Hop. Something they call it in England, actually, is a hip, of course, your hip, and op, PP is for the operation, and they just say hip hop. So I'm going to call it that in the playlist. So this will be, I guess, the first video in that hip hop series. So yeah, if you're interested in what's going on in Jasper's life, as far as, or just real time, what's actually happening in the recovery of a hip replacement operation, then hey, stay tuned. Maybe you'll get something out of it. I don't know. Again, a few people had asked me, would I consider doing that? And I said, sure, I would. Of course I would. So, hey, it keeps things interesting. So you know what? That's it for now. I will talk to you next time. Again, stay tuned for my Rideau Trail videos. In fact, I think I have day 6 going to be uploaded later today, which actually will be before you see this video, but that's so be it. This video will be the next video out. Talk to you later, guys. Have a great day. Bye-bye.